Harkins, Hickman, Hill, Hobson, McMahon, Tate, Turner Ford, Wiggins. We have a quorum.
Such as it is. Thank you for coming. And thank you for coming to the hearing that we had earlier. It was, as you know, somewhat chaotic because of the schedule that day. And we didn't have a chance to have sort of a quasi-organizational session or whatever. So I thought I would do that today. I didn't have a chance to make clear that some of the witnesses that we had from the at the hearing had come a long way. We had the students from the nursing school at Mississippi University for Women. I think we may have mentioned this, but we had one witness who came all the way from Los Angeles to be with us. And we had another witness who had been at the emergency room at the University of Mississippi Medical Center all night long and stayed up very late without rest to come talk to us. So we all very much appreciated they're going to so much trouble to come, and I appreciate your being here to listen to that. We have two new members of the committee. We have Senator England. He's the one over there. And we have Senator Boyd, who's a new member of the committee, and she's absent. You mark down that she's absent. Yeah, okay. And we have a new vice chair, Senator Parks. So those are changes since the last committee meeting. I'm not happy that anyone is not here, but by the same token, I'm happy that the new people are here, and I think we've got a good group. I was going to mention to you very briefly sort of my thoughts about what we might do during the year, just to give you an idea of what my initial ideas were. And I'm happy to listen to anything you have to talk about or want to do, and can do that now or later or whenever, but I'm interested in hearing what the committee thinks about things. First of all, regarding certificates of need, there was the bill that we passed last year that the governor vetoed because he disagreed with one provision. I spoke with my counterpart, Chairman Creekmore, about this prior to the session, and we agreed that the best course of action would be just to reintroduce the bill without the objectionable section and try to get it passed early in the session. It's from and after passage, and I don't think there's any objection to anything that's in the bill. So at least that would get those provisions into the law, which I know a number of people would be interested in. The bill was doubly referred in the House. I'm told that it's going to get out of the second referred committee and work its way over here next week. That's the status of the bill so far as I know. So far as I know, the House still intends to send us that bill. And when it gets here, my suggestion would be, let's send that to the governor, get that out of the way, and then we'll take up the business of this year's work. I have been personally very cautious about CON legislation because, as with many things in this committee, I at least know that there are unintended consequences. I know there will be things that come about that we do not anticipate. I don't know what they are, but there's a reason to be cautious. Having said that, there are the following things that have been discussed, which I think have some merit. One, in the most general of terms, deals with rural hospitals, small hospitals, discuss the definition of those later. But small hospitals are struggling. We need hospitals throughout the state. We need hospitals in rural areas, which actually are hospitals. It's just very critical to a community for 18 different reasons to have a hospital. What has happened over the years is that, as you may have noticed, hospital stays are shorter than they used to be. There are also a number of procedures which formerly were performed in hospitals that are now performed outside hospitals. Those tend to be more lucrative than some other things that hospitals do. And as those sources of revenue and just the volume has moved out of hospitals, life is getting more and more difficult for hospitals, particularly small ones. One of the things that I would like to see us do is in some way, in some circumstances, capture some of that revenue so that it can be plowed back into the hospital so that the hospital can have a source of revenue and a critical mass to continue to operate. That may all sound vague, and it's even more difficult if I were to try to write it down instead of just talking vaguely. But I think we're going to do something in those areas. There's been much discussion about dialysis. I have lots of doubts that the ability of a small hospital to have outpatient dialysis actually will be practical and helpful to its inpatient operations. But others think differently. There are a lot of, it's a spectrum. There are a lot of things to do in places, lines to draw and all of that. So I think we'll be looking at something in that area. There's much concern about just generally care for mentally ill. I think we're likely to look at something in that area. Those are my thoughts as of now. In addition to public health, of course, we have the issue of public welfare. And one of the problems that is a huge problem from a number of perspectives is the availability and the affordability of daycare. There are a lot of ways to get from point A to point B, but it's just a fact that a lot of people are not in the workforce because of lack of daycare. And there's interest in increasing the size of the workforce. So that's a matter that's before us. And then many other things that I'll not mention now. But I thought we should have this organizational meeting, as it were, and that I should share with you at least my thoughts. And I'll be happy for anyone to express thoughts now if anyone feels moved of the spirit. It's like a Quaker meeting, you know, if you the Lord seems not to be speaking to anyone, but very seriously, I need your help in thinking through these things. If there are matters you're concerned about that work their way to this committee, please let me know. And if there's nothing else, I'll entertain a motion to rise and report. Oh, there's a motion to rise and report. All in favor, aye. Opposed, no. It appears the ayes have it. The ayes have it. Thank you for coming.